Hi guys, it's Dr. Bradley here. Today we're going to talk about sciatica. Sciatica is a pain that runs down the back of your leg, and it's caused by a large nerve that runs down the middle of your leg called the sciatic nerve being irritated. There are different causes of sciatica, from disc herniation to sacroiliac dysfunctions, misalignments in your spine. But what we're going to focus on for this discussion is what we call piriformis syndrome, causing sciatica. Your piriformis is a muscle. It's a deeper gluteal muscle that runs from your tailbone to your hip. That muscle can get tight, particularly in people who have sports where they externally rotate a lot. So it's really common in runners who have an externally rotated posture when they run, for that muscle to develop a shorter, tighter position. When that muscle does become short and tight and becomes inflamed, it can irritate the sciatic nerve, because your sciatic nerve, depending on the anatomy, either runs through that muscle or underneath that muscle between the piriformis and another muscle called the superior gemellus. So today we're going to talk about a few simple things you can do if you're suffering from sciatica, a few simple things you can do from home to try and alleviate the pain. We're going to talk about a stretch, a mobilization technique, and 2 strengthening exercises. So stick with me. I'm going to show you the stretch next. For the piriformis stretch, you want to lay on your back. The side that's tight, you want to bend that leg, hook your foot over the opposite knee, and drop the knee down. Then you want to bend your left knee. In this situation, we're stretching the right. We want to pull the left knee up towards our chest and reach behind our hamstring and pull towards the chest, keeping the right knee pressed down to effectively stretch the piriformis muscle. We're going to show this stretch from the other side as well. So if you want to stretch the left piriformis, you bend your left knee, hook your foot over your right knee. Now you want to bend the right knee, reach behind the hamstring, and pull your right knee up towards your chest, keeping your left knee pressed down, effectively stretching your piriformis muscle. Perform this stretch 3 to 5 times each side for a 10-second hold. Now we're going to show a soft tissue mobilization technique, or a self-treatment for a trigger point of the piriformis muscle using a foam roller. Simply lay over a foam roller in this position, get the foam roller right into the tight sore fibers of the piriformis muscle, and roll back and forth. You can change the angle. As you can see, I'm rolling from one side to the other to try and find the most symptomatic spot in that muscle. If you hit a sore spot and you reproduce the sciatic pain, then you know you are on a trigger point and you really want to mobilize that muscle to loosen it. Now we are showing the supine hip extension. Lay on your back, bend your knees, and lift the pelvis straight up in the air, contracting the glutes. You can change the angle of your knees. You can bring your feet closer up towards your body. This makes the exercise a little more challenging, or you can move the feet slightly away from the body. Just find what's comfortable for you. This exercise should be performed for 10 repetitions for 3 to 5 sets. And this is a strengthening exercise for the gluteus maximus. Now we're going to show the wall squat using a Swiss ball. You want to make sure that you keep your back straight. Don't want to lean too far back against the ball. You also want to be too far forward either. Make sure that your knees are lined up over the tops of your first and second toe. If you are tight in the piriformis, you will have a tendency to turn out or have external rotation of your feet. If that's the case, make sure you pull them into a nice straight position. We're going to show this exercise from the front and showing proper knee alignment. The knees should fall right over the first and second toe. If you have tight piriformis muscles, sometimes the knees will want to turn out, as I'm showing now. If that's the case, just make sure you draw the knees in and keep them over the toes as you perform the exercise. Likewise, if you are internally rotated, your knees will want to drop in. And if that's the case, correct that, make sure the knees track. Perform this exercise for 10 repetitions and do it for 3 to 5 sets. Thanks for watching my video. I hope that you found these exercises and stretches helpful and informative, especially if you're suffering from sciatica. If you don't get relief with these exercises, or if you're unsure as to whether or not you're doing them properly, please seek professional help through either a chiropractor, a Czech practitioner, or a physical therapist. Just make sure that any of these people are knowledgeable and skilled with the techniques that we're discussing here today. If you did find this of value, please like and comment below. Also, visit our website for more information on any common causes of pain and dysfunction throughout your body. We have a lot of blogs and videos that I hope you find helpful. Once again, thank you for watching. Yours in health, Dr. Bradley.